Well, good morning, everybody, and welcome to AlphaBiolabs' latest webinar. Drug trends are changing. Are you testing accordingly? It's great to have so many of you join us this morning. Thank you for your time. So my name's Andrew Priestley, and I'm the Legal Marketing Manager here at AlphaBiolabs. And I'm joined today by my colleague, Ashley Friday, who's our Sample Collections Manager. So we've got quite a jam-packed agenda to get through this morning. Excuse me. We're going to keep it within the 45 minutes. So I'm going to open up with a section. I'm going to just look at as the title of the webinar suggests, the sort of what we see as the sort of main sort of changes, trends in illegal drug taking. So we're going to cover the rise of synthetic substances, prescription medication misuse, and polydrug use. I'll also give you a bit of an insight into the major drug groups because I think giving you that structure will help when it comes to selecting the drugs that you need testing for a particular case. And I'll also mention our latest guide that's come out on major drug groups, which you can request a copy of at the end of the webinar by completing this short survey. Finally, then I'll give you an overview of the drug testing panels we have at AlphaBiolabs before handing over to Ashley, who's going to show you how to choose the right test for your case. Ashley will also use the opportunity to give you a refresh on how the sample collection process works at AlphaBiolabs. We'll then conclude, as we always do with our webinars, with a live Q&A. We've had a couple of questions being put forward when people have registered, so we will answer those questions. If you think of any other questions during the webinar, then please do use the Q&A function on the Zoom technology, which we're using today, and we will answer those questions as well. If we don't have time to answer all the questions, if we do run out of time, then don't worry, we will get answers to you later on today. So please feel free to ask as many questions as you want. Okay, so I'm going to start. So the rise of synthetic substances, prescription medication misuse, and polydrug use. So for those of you that attended the last round of webinars back in November, I used a report from the Office of National Statistics called Drug Misuse in England and Wales for the year ending March 2024. What I've done now is we've had the latest reports come out since those webinars. So we've now got the survey for the year ending March 2025. So I've updated the statistics that we talked about last time with the latest survey. It's a really good study to review because it does represent households, which are probably typical of the families that you tend to represent. It does exclude any sort of criminal usage, drug usage, homeless drug usage, and people currently in treatment. The survey they tend to ask up to about 35,000 households selected at random across England and Wales to participate in the survey. It's just one individual per household. It's not mandatory to complete it, but the ONS do tend to get a good response. And with those responses, they then produce estimates for the population as a whole. So they basically look at the response and then they build it up as if it was the equivalent of across the whole of the England and Wales for certain age groups. A couple of things to bear in mind here when we talk about drug misuse. With this report, it's defined as someone who admits misusing any drug at least once in the previous 12 months. And we'll also talk about polydrug combinations. A polydrug combination is where more than one drug is used by someone at the same time to enhance the effects of both drugs, or where they use them both in close proximity to each other. And I will give some examples of that because that's a key area where we're seeing some changes. Okay, so this chart, what I thought I'd do is there's a lot of data in this report, so I just wanted to summarize the key data for you. So I've basically ranked the top 10 misused drugs according to this report, and these are estimated figures that the ONS have come up with. So cannabis, as the name suggests, is part of the cannabinoids drug group and continues to be the most illegal drug. And you can see there the light blue bar, that's for the March 2025 survey. So it's dropped down a little bit compared to previous years, but there's still 2.15 million adults in this age category having used it in the previous 12 months. Then we've got cocaine and MDMA, or ecstasy, as it's the street name. Uh, Both illegal drugs, as you will know, from the stimulants drug group. They're ranked second and third. And in the latest survey, we can see that for cocaine, there was 693,000 people estimated to be misusing cocaine, and 392,000 people believed to be misusing ecstasy. Then we have hallucinogens, which is actually a drug group in itself, and you probably see there it's commonly used as MDMA is, very similar sort of numbers. Some hallucinogens are naturally produced, but others are synthetic substances, like ecstasy is produced. And the important thing with hallucinogens, none of them can be prescribed, so there's no way of getting hold of them as a prescription. It's all illegally obtained. So it would include drugs like LSD, magic mushrooms, and some additional new ones coming on the street like mescaline. Um, what's interesting though is you won't really see hallucinogens as a selection option on a standard drug panel. That includes ourselves. We don't have it on the standard drug panel. So you would need to look at the extended drug panel to select hallucinogens. However, MDMA, which you can see from this report, is a similar sort of level of usage. You will find that under methamphetamines on most standard drug panels. So the drug panels are not quite adapting as yet to the change in usage that we're seeing in England and Wales. Then we've got ketamine. That comes next, and it's classified separately in this report, even though technically it is an example of a hallucinogen, and we would cover it in our hallucinogen panel. It's more specifically classified here by the ONS as a dissociative anesthetic. The use of ketamine continues to be a widespread issue. I'm sure you've read about this. You might have seen programs such as Panorama covering it. It's a real concern, and it's a drug to always be mindful of. It's very easy to obtain. It's cheap. It really is a widespread issue. It's very potent, and unfortunately, it's extending to being used by young adults and even teenagers. Then the last one on this slide, in sixth place, is the amphetamines. Amphetamines, another type of stimulant drug. They're all prescribed as a rule, and it's the sixth highest misused drug according to the latest survey. Please do note that where we talk about prescription drug, the usage figures. So in this case, for amphetamines, about 79,000 adults aged between 16 to 59 illegally using it. That's exclusive of any legally prescribed use of an amphetamine. And then we've got on the next slide, to complete the top 10 list, we've got opiates, which are naturally produced opioids like morphine, and heroin, which is a semi-synthetic opioid. So they follow in seventh place, but as you would expect, there is a significant drop in estimated usage here. So for the latest survey, the ONS estimate that about 21,000 adults between age 16 and 59 are misusing opiates, including heroin. But it's still a significant number, and it still needs to be considered. And opiates and heroin you will tend to find on most standard drug panels. Then we've got methadone, which is an illegal Class B synthetic cathinone stimulant drug. Interestingly, it's a very similar level of usage to opiates and heroin. However, you very rarely find methadone on a standard drug panel, like you would with opiates and heroin, even though, like I say, it has a similar level of usage. So again, in our case, if you wanted testing for methadone, you'd be having to look at our extended drug panel to do that. And then completing the top 10, we've got methadone, which is a Class A prescribed drug, and methamphetamine, which is also a Class A but illegal drug, both of which you would expect to find in a standard drug panel. Okay, so that was the ONS report. I also spent a bit of time looking at some other data sources. I just wanted to find some other examples for you of the sort of drugs, and certainly when it comes to polydrug use, the different combinations that you should be thinking about, which might apply to a particular case that you're working on. So the first one I've got on this slide, you can see there, anticonvulsants. These are prescription drugs. Two most common are pregabalin and gabapentin. They're normally used for conditions such as epilepsy, for example, anxiety. What's interesting is I found some statistics about the huge increase in prescriptions of those two drugs. Pregabalin by 8% and gabapentin by 29% between 2024 and 2025 across England and Wales. And sadly, pregabalin seems to be involved in a rising share of drug deaths and polydrug use with, for example, sedatives like benzodiazepines, so like sleeping pills, and even cocaine. Gabapentin also is more commonly used as a polydrug, particularly in opioid misuse, including in some cases with heroin. Then I've put down benzodiazepines, which are sort of like your sleeping pills, etc. Increasingly being found to be brought on the street illegally because they are prescribed drugs, but they are increasingly being brought illegally on the streets. Along with other sedatives like zopiclone and zolpidem. So again, just thinking about those sort of things. Then we've got tramadol, which is a Class C opioid. Has also seen a huge increase in prescriptions by 33% between 24 and 25. What we've seen with tramadol as a result probably of that is now tramadol is available on most standard panels, like top 9 court ordered drugs. It's on our standard panel now, and you'll probably find it with other providers as well. And then the last one I just wanted to mention, quite an interesting one, was antidepressants. Antidepressants aren't a controlled prescription drug, but they are a really strong example of increasing polydrug use in combination. Could be with any of those above mentioned drugs that are mentioned there. But also what's interesting is I read a lot about mixing antidepressant use with alcohol use. So for people who have an alcohol issue, so excessive chronic alcohol consumption, they often can combine it with using antidepressants excessively as well. So they're just real examples of, whilst the sort of standard level of illegal drug usage across England and Wales is probably year on year stayed fairly similar, it's just the makeup is changing a little bit. So you just really need to bear that in mind. So I'm just going to give a very quick insight into the major drug groups and an overview of our drug testing panels now to help you sort of with making these decisions. And also you can see on the screen there, on the right-hand side, there's a screenshot of our latest guide called The Main Drug Groups in the UK, Legislation, Medical Applications and Symptoms of Misuse. If you complete the very short survey at the end of the webinar, you can request electronic or printed copies of that guide to be sent to you, and also you can share it with colleagues as well. But really what we've done here, we thought it'd be useful to try and give a bit more structure to assist you when you're making these decisions over what drugs to test for. So the guide breaks down into the major 9 drug groups. So there's 4 on that slide. So the anticonvulsants, so some of which we've spoken about already, antidepressants, antipsychotics, and cannabinoids, which includes cannabis and spice, which is a synthetically produced cannabinoid. And then we've got hallucinogens, which we've talked about, opioids, sedatives, steroids, and stimulants. So the guide will look at each drug group. It will talk about the legislation around it. So, what class, if it's controlled under the Misuse of Drugs Act, the MDA of 1971, is it a Class A, Class B, or Class C drug? If it's not covered on there, what other act is it covered on? If it covers prescription drugs, what are the typical sort of medical applications where it might apply? And then finally, and you might find this particularly useful, is there's a table with symptoms of misuse. So, for example, for hallucinogens, it will give you, if you've got a client who's maybe excessively using 2 or 3 hallucinogens, what are the typical symptoms you would expect to see from that person due to that excessive misuse? We're not medical professionals, and we made it clear on the guide there. So this is based on our own experience, and it should hopefully just give you a bit more guidance in terms of, well, we know we need to test for X drug, but actually I think we might need to check for Y and Z as well, based on the symptoms our client is showing, what they're telling us they're using, that sort of thing. So it hopefully helps you be more accurate in terms of covering all the drugs that you need to test for a particular case. And just to finish off before I hand over to Ashley, so just to confirm, so this is our standard drug panel as it stands at the moment. If you went onto our website and wanted to request from us, so that's the top 9 panel, or the top 9 court-ordered drugs, most of which I've mentioned. You might want us to test for all 9, or for any sort of selection of them. You can pick and choose as you want. And then you've got we call it a non-standard drug panel, so it's an extension to the standard panel. And as you can see then, hopefully you'll find this convenient, is we've now structured that into the 9 main drug groups. So again, in conjunction with reading the guide, it should help you. So for example, with hallucinogens, you can see there that we can test for 5 different types of hallucinogen. It might be that you just want us to test for LSD, but you might want us to test for all 5. Similar with antidepressants, we've got a panel of 5 there now as well. So again, you can custom select what you want us to test for. And based on what you want us to test for, if, say, for example, it was the full hallucinogens panel, we can offer discounts on our prices for what we're testing for. Okay, so hopefully you found that useful. I'm now going to hand over to Ashley, and she's going to talk to you about how to choose the right test for your case. Ashley.
Hello, good morning. Thank you for joining us. So as Andrew said, I'm going to talk you through how to choose the right type of test. So once you've decided which drugs you wanted to test for, how do you then decide what methods to use, what samples to collect, and things like that? So first of all, we're going to talk about testing for drugs using a sample of head hair. This is our most popular test because we can look at patterns and trends within someone's use. Now, if you have joined us on our webinars before, you will know that we speak about the average growth rate of head hair, which is approximately a centimetre per month. This is how we allocate timeframes to drug use. So we can look back up to 12 months in someone's drug use, but we would require 12 centimetres of head hair in order to do that. And this is why when you look to instruct a drug test and you decide what drugs you're looking for, you then need to consider that particular client, what type of sample they have available, and what exactly you would get from that sample type. So if we're speaking about head hair and we're looking at an average of a centimetre per month, there's 3 types of drug tests that are then available. You can have your analysis as an overview. You can have it month by month broken down, or you can have it bi-monthly. And which one of these you pick will depend completely on the case that you're looking at and what you're looking to prove or disprove about someone's drug use. The first type is an overview analysis. So the overview analysis is the most cost effective of the 3. And this would be useful in a case where you kind of already know what you're looking at results wise. So for example, if you had a client who had never used drugs and just needed to prove that, an overview would be perfect. You know what you're expecting to see, which is that negative result. So you don't need to look at patterns and trends within that person's use. As I mentioned before, we can look back up to 12 months, requires 12 centimetres of head hair. Or we can look at shorter timeframes if you had a client with shorter hair, for example, 3 centimetres. We could just look back over 3 months and you'd get one result for that 3 month period. If you had a client who had, for example, 6 centimetres of head hair, we could look back over 6 months and you would get two results for that time frame, each one covering a 3 month period. The other time when this is beneficial is if you wanted just a base reading, so somewhere to start on someone's history they may have used in the past, but now they're looking at joining a program to reduce that, and you just want to know what exactly that starting point was. This could be a beneficial use of this type of analysis. The second option, probably the most popular, is a month-by-month segmented analysis. This is where you would be looking more at patterns and trends within someone's drug use. So, for example, again, up to 12 months we can go back if someone has 12 centimetres of head hair, and you would get an individual result for each month with this type of analysis. So if you had a client who had used in the past but had started to either reduce that use or abstain from use, or if someone had alleged that they'd increased their use over that time, this would be a good way of assessing that and looking at those patterns and trends, whether the use has gone up or come down, or whether they have abstained. So this would be the most popular for looking at that type of thing. Then lastly, you've got your bi-monthly segmented analysis, a little bit more cost effective than your monthly segmented. And this looks at chunks of 2 months. So again, if you were looking at someone's pattern or trend, but you didn't need it to be month by month, you could look at bi-monthly analysis. So for someone who's got 6 centimetres of hair, we could look at 6 months and you'd get 3 results for that time frame, each representing a 2-month time analysis. So they're the 3 options, and this is the most common type of testing that we would do. It's the one that we would advise you go for if you have a client with a sufficient sample to do so, because you can look at the patterns and trends during that time. And then if you did want to do repeat analysis on head hair testing, you could look at it over a shorter time frame. So if you did 6 months today, for example, and then you wanted going forward to look back every month, head hair analysis would offer you those options. However, that's not always possible. Sometimes we have clients that don't have sufficient head hair, or for other reasons may not want to provide a head hair sample. And we do offer some alternative testing methods in those cases. So the first one would be to test a sample of body hair. For drug testing, we can use underarm, chest, leg, back, forearm. If they've got it, we'll collect it. And that'll look back up to 12 months as an overview. So if you were looking at those patterns and trends, body hair might not be suitable and you may want to go for head hair instead, because you're just going to get one result for that time frame as a whole from the body hair analysis. But again, if someone's not used, or if you're wanting to get a starting point for them to understand how much they're using, then body hair might be the right option. We can also test samples of beard hair. However, this is dependent on the length as to how far back this analysis will look, as a maximum of 12 months. So what would happen is we would collect the sample at the appointment, bring it back to the laboratory, measure it here, and then give you the time frame for beard hair. But again, that's an overview. So one result for that time frame as a whole, which is something to consider before instructing. Other methods, if body hair or head hair isn't available, we can look at nail clippings. So we can look at fingernail clippings. They would offer us up to 6 months as an overview, or toenail clippings up to 12 months as an overview. And again, that would be one result for that time frame as a whole. So you need to consider whether that's suitable for your case. And that's something that we can assist with if you were looking to instruct as to what would be the best option. Sometimes when we get there, we go for a particular type of sample and it might not be sufficient when we arrive. And all of these things you can select on your online form to make sure that we get the most suitable sample that's available at the time. But especially if you haven't maybe met the client in person before and you're not sure what samples they have available. So those methods that we just spoke about, the head hair, the body hair, and the nail testing, are all what we would refer to as wider window testing. So they're looking back over a number of months over quite a large time frame. Sometimes we also want to look at a narrow window of testing, so a shorter time frame. For example, if someone's having visitation with children, we might want to know what they're doing right now, not what they were doing over the last 6 months. And there's different forms of testing for that as well. So the first one would be oral fluid testing. This would look back approximately 2 days from the time that the sample was collected. And it's just an oral fluid swab in the mouth, completely pain-free. And then that's sent off to the laboratory and the report issued directly to yourselves or the person instructing the case. This can be really beneficial if you're wanting to what we would refer to as bridge the gap. So from having a hair sample taken, that's looking back over a period of time, whereas things like oral fluid are looking at the here and now and the last 2 days of use. So they can be particularly beneficial during that time frame. The other narrow window testing is a urine sample. So this looking back approximately 4 days. So again, if you had someone who wanted visitation with a child, for example, and you wanted to know what they were doing at that time, or shortly before that, we can look back over the last 4 days as a whole in a urine sample collection. Due to the nature of urine samples, how the sample needs to be provided, and the risk of adulteration, we do only offer this type of testing at our walk-in centres, but they are based up and down the UK, so there should be one within close proximity of where your client lives or one that they can travel to. Here are all the drug types that I just discussed. So you're looking at the narrow window of detection in oral fluid in urine, and then that wider window for all the other sample types. It is important as well to consider if you're looking at covering a specific time frame with this type of testing, that we need to allow time from when a drug is ingested to it being present in this type of sample for wide window testing. So from the initial ingestion of the drug to it being available for results in a head hair sample, we state that you should allow 14 days for that process to take place and it to be visible in that hair sample. That means that you've got a 2-week gap from when that person last used that you want to assess before you collect the sample. So for example, if you had someone who needed testing from the start of May, looking back, then you'd be looking to collect that sample from today realistically so that you're covering those dates. And again, that's something we can discuss with you. If you do instruct and you have specific timeframes you want to cover, we can look at what the best options are for you. And if you did want to cover that gap in between as well, then you would look at implementing maybe some repeat urine testing or oral fluid testing to make sure you've got the whole timeframe covered. So why combine the two? I just mentioned using them hand in hand to cover all timeframes. It can support abstinence monitoring. So recent compliance with abstaining from use can be detected within oral fluid and urine if you wanted to do that. It can ensure a balanced assessment. So if you did have someone who had maybe used in the past but was reducing that use, doing the two of them together can start to show that reduction and then also monitor them going forward. And it prevents misinterpretation of samples. So if, for example, you had someone who was able to abstain from drug use, wasn't drug dependent, and they could abstain for those 4 days or 5 days before giving a urine or oral fluid sample, that could give a negative result, but it might not be an accurate or true reflection of someone's drug use. So it going hand in hand allows you to monitor the here and now, but also look back at historical use to ensure that if we are considering safeguarding, that we look at the picture as a whole and not just a snapshot of it that might not give the full picture. Repeat drug testing, I did briefly mention earlier, if you wanted to do that. For example, if you wanted to do repeat urine testing to make sure that someone was complying with reducing the use or abstaining from use, or if you wanted to do repeat hair strand testing so that someone is following the program and you can monitor that on, for example, a monthly or a bi-monthly basis. Repeat drug testing is really beneficial, so it can provide clarity over that time, someone's patterns of use. If someone does relapse or if they are able to abstain, you can have a look at that across multiple time periods and different tests. It supports evidence of compliance. So if there was something in place that that person was doing, reducing use, abstaining, then you can see that compliance in something like a urine test rather than waiting and then looking back in the hair strand testing. It supports rehabilitation and it assists with improved safeguarding, so allowing you to act quickly if risk increases by doing things like repeat urine or oral fluid testing. So there's plenty of benefits in relation to repeat drug testing. As Andrew mentioned before, we do have our free reference guide. If you complete the feedback survey at the end of this webinar, which does help us improve them and provide content that's suitable to yourselves, you can opt in for the reference guide at the end. It does cover alcohol as well. I know this webinar is specifically referring to drug use, but it does cover alcohol as well. Really useful, really beneficial, and can be sent electronically for you to just have saved to your desktop to refer back to as and when needed. So you can request that at the end. If you don't complete the survey, you can always email us for a copy of it as well, and we can send out a hard copy version if you wanted them maybe to keep on your desk or to pass out to other people in your office. If you do choose to instruct with us, you will be allocated a dedicated account manager from the point of instruction. Once we register your case, we will contact the sample donor within 2 hours of that to try and get them booked in. We can either book them in as soon as possible, or we can delay the booking in. So we could book them in now for in 2 weeks' time. If that suits the timeframes that you want to cover, we would work with you and them to facilitate the best options for your case. It goes without saying that all our donors are treated with empathy, dignity, and respect, and that is throughout the collection process by all members of our team. It's really important to us that the sample donors are treated with dignity and that we can accommodate them where possible as well. Your dedicated account manager will coordinate your collections. When the sample reaches the laboratory, they'll keep you up to date with all the information that you need, and you know exactly who you're speaking to when you ring in. So you've got them all the way through whenever you need them for advice or for updates on that particular case. So we've spoken about what drugs we're able to test for. Andrew's shown you through the form and how the options are presented, and I've just discussed with you how your options are for what type of samples and what timeframes they'll cover and things like that. Now we're going to talk quickly about the sample collection process and how that works. Those of you that have joined our webinars before will be aware of this, but it's always handy to recap exactly how these things will work. So prior to the appointment, whether we organise the appointment through yourselves or directly with the sample donor, we'll always remind them that ideally they'll bring photographic ID to their appointment. So a passport or a driving licence is preferred if they have that available, just so we can confirm that we have the right person providing the sample. Depending on the sample type, we'll ask that the hair or nails are clean and dry and without product. So we don't want things like nail varnish or acrylics, anything that could stop us from being able to obtain the sample. So we'll remind them of that. We'll ask that they avoid any chemical hair treatments, so bleaches, dyes, perms, before the appointment, anything that could affect the results of the testing. And that they bring with them any medication that they take or have consumed during the testing time frame, so that we can include that in the report and comment as to whether that could have had an impact on any of the results. We'll also ask about any religious, cultural, or accessibility needs so that we can accommodate those in advance. And we also ask you that on the referral form as well, just so that we can be prepared and we can make sure we can accommodate anyone. We also send out a text message reminder before the appointment with all of this information on so that they can read it thoroughly if they don't process it during the phone call, and ask any questions beforehand to make them feel as comfortable as possible. The appointment durations last roughly 30 to 45 minutes depending on the sample type and number of samples. As I said, we'll ask for their photographic identification and for them to confirm their personal details to make sure we've got the right person. And we'll also take a photograph of the sample donor so that we can show to you exactly who we took the sample from and to make sure that it was the right person that has been tested. All of this forms that chain of custody so that these results are legally defensible in court. Head hair and body hair is usually cut using scissors. Obviously, they're cleaned before and after every appointment, but body hair can also be shaved using a disposable razor. It just depends on the kind of quality of the hair at the time, and the collector will make that decision on what the most suitable collection method is. And for nail clippings, they're cut using clean clippers. The sample collector is the only person that handles the collection scissors or the razor or the clippers. They take the samples, they package the samples, and of course they sign to state that they followed the chain of custody, as does the donor to state that they witnessed all of that taking place. The samples are packaged and documented in the presence of the donor. We would never take them away before packaging them up. Like I say, they sign to say that they witnessed them being sealed and collected, so it's really important that we do that. And we always have a B sample as well, just in case there's any dispute in the testing or if the A sample is insufficient and we need to use that second sample. We complete a consent form at the time of the appointment, and then that sample is tracked at every stage from collection through to the issue of the results. That all makes up that chain of custody to ensure that the results are legally defensible in court. Occasionally, we are sadly asked to collect samples from children who may have been impacted by drug misuse. These are usually conducted alongside parent testing, so where a parent's being tested at the same time, to determine if the child is ingested or being exposed to a drug. There are a few things with children's samples, so their hair samples are more sensitive to contamination and at higher risk of environmental exposure. So an expert report is mandatory on all of these samples. Growth rates can vary as well, depending on the child's age and their health and nutrition. So it's really important that we provide the full picture via that expert report, which is why that's mandatory in child sample collection cases. Due to the nature of children's hair, with it sometimes being thinner, the sample site that we take the hair from can be much larger than an adult's. And we would always make yourselves and the person who the child's in the care of aware of this prior to attending the appointment. We do need the same weight as an adult sample with a minimum length for children of 3 centimetres, but due to how fine the hair can be, that sample site can appear to be much larger, which is what we make you aware of. That's why sometimes it is suitable to use nail clippings as an alternative, especially if you're wanting to see if the drug is present, you're not looking at patterns and trends. That might be the better alternative, given that the child could become distressed if we are cutting hair samples from them. But we'll always do our best with children to make them feel as comfortable as possible. And of course, we need an adult with parental responsibility at the appointment throughout, not just to provide consent and answer questions on behalf of the child, but also to make sure that the child feels comfortable and secure during that time and that they can ask any questions to that person with parental responsibility if they're not comfortable asking the collector themselves. I've mentioned our sample collections team. We do have a team of professionals that cover the UK and Ireland. They can come out to any address required. However, we do also have our free sample collection centres, which you can see marked on the map there. We have 21 currently. So if you did have someone who was providing a urine sample, or if it wasn't appropriate to go to their home address, then they could utilise one of our walk-in clinics where sample collection is free of charge. And all the information on them can be found on our website, or your account manager can advise you on those too. So I'll hand you back over to Andrew now for the Q&A session.
Thanks very much, Ashley. Okay, so we've got a few minutes. We're just going to answer a few of your questions now. As I mentioned at the start of the webinar, there was a few questions submitted when some people registered for the webinar. So we're just going to address those. If anybody else has any questions they can think of now, then please do use the Q&A facility and we'll try and answer those as well. Or if indeed you think of questions after the webinar later on today, then you can contact us and we can answer those questions for you as well. So first question is, I'll answer this one, Ashley. What are the key new substances which are being used? Well, hopefully I've covered that in my section of the webinar. But again, just to summarize, I would say certainly ketamine is one to think about. Your range of hallucinogens, so your LSD, your magic mushrooms, but new kids on the block like mescaline as well. Methadone is one that you won't always find on a standard drug panel, but it is increasingly being used. Anticonvulsants like the gabapentin and the antidepressants like Prozac. And again, thinking about those polydrug combinations, so it could be that a particular client could be using a mix of both standard and non-standard panel drugs. So, often a court will say, well, test for the most common drugs, top 9 or whatever. It's just being able to think beyond that as well to say, well, actually, we might need to test for these types of drugs as well. So hopefully that's covered that. Next question was, in situations where it is believed parents are using substances, however unclear what, are there options for wider screening that will just show positive or negative results and then can inform the testing that should take place? So what we do offer with the standard drug panel is we offer Drug Screen Plus. And you can request, when you request the quote, you can mark that up. So say, for example, you definitely want your client to be tested for, say, cocaine and cannabis. We will definitely test for those two drugs, but then you might want to select Drug Screen Plus, and that means we'll also look to see if there's any other drugs within the standard panel that we can find in the sample that we take. At that point, we will then tell you if we found anything or not, and then you can decide if you want to pay for that result as well. Unfortunately, as it stands at the moment, we can't do that with the non-standard drug panel. So if it's a drug that you want testing from the non-standard drug panel, you have to select that, and whether we find that drug or not, then you do have to pay for it. So the Drug Screen Plus option is there, but it is just for our standard panel. Okay, couple of questions on the sample collection process. So for yourself, Ashley, is the sample collection process the same for standard and non-standard panel drugs?
Yeah, it's a short answer. Yeah, it would be exactly the same process for standard and non-standard. Depending on what non-standard drug was selected, sometimes we have to take additional samples. So the minimum number of samples we would take would be 2 for a drug test. But if you did have additional non-standard drugs that required more weight for the testing, then we may have to take additional samples. But that would all be done at the same appointment, and we'd be aware of it in advance, and the collection process is the same. So still photos and ID, same consent form, same questions.
That's great. Thanks, Ashley. Next one. Can you attend a person's home without a solicitor or social worker present, or do we need to be there?
No, you don't have to be there. We do lots and lots of collections where we don't have anyone else present. It's just ourselves and the sample donor. If you would like to be there, you're more than welcome to join us. Sometimes it can be useful. So if you have a particularly difficult donor that you know might need some extra support, or if you have someone who is quite nervous and maybe have a good relationship with them, you may feel it more appropriate that you are present, and that's absolutely welcomed. But we are more than comfortable attending someone's property, just ourselves and the sample donor.
Thanks, Ashley. We just had another one come in on sample collections. So another one for yourself, Ashley. Do you insist on ID? As we have recently had a service user who stated they had forgotten the ID and was later found out to be posing as his brother, which dramatically delayed court proceedings.
Okay, yeah, so we have had cases of this before where someone's posed as someone else. Do we insist on ID? We do our best, yes. A lot of the time, sample donors don't have suitable identification, or they'll provide something that's not photographic, so like a letter or a utility bill, which we will accept if there is no alternative. So although we do our best, we can't obviously force them to provide something, and we would still take the sample without identification because a lot of people just simply don't have it. That's why we take a photograph of the donor, and that's why we include the photographs in the report so that we can make sure that the right person was tested. If you did have concerns of this, though, you could make us aware in advance. We've had this before, where we go out, we take the sample, we take the photo, and then we send that to you, the photograph, before we do the testing to make sure it was the right person. But unfortunately, insisting on ID, we would have a lot of failed appointments if we started doing that because people simply don't have sufficient photographic ID all the time. So yeah, apologies that happened, but it is unfortunately part and parcel of it, and that's why we insist on the photograph. If someone will not have a photograph taken, and it's not for cultural reasons or anything like that, then we would refuse the collection appointment because, of course, we've got to be able to prove who we took the sample from.
Thank you very much, Ashley, for that. Okay, guys, we're just about up with time now. It's just come up to 9:45. So just to finish off, firstly, big thanks to Ashley for presenting with myself today. And thanks to all of you for your time, your valued time. If you do think of any more questions about what we discussed today or drug, alcohol, DNA testing in general, please do contact us. There's our main details there. So our website, alphabiolabs.co.uk. You can call us on 0333 600 1300 or email the new inquiry team testing@alphabiolabs.com. They can help you with specific requirements and obviously put together any quotes for you that you require. If you're on social media, LinkedIn in particular, please do give us a follow on there. We've actually just hit this morning the 6,000 followers mark. We do post on LinkedIn every day, really, Monday to Friday with new content. So, yeah, please do look us up if you're not already following us and give us a follow. We're also on the X platform as well, where we have about 1,200 followers, and we post almost daily on there as well. So if you want to keep in touch with us through social, then please use those two channels. Just a couple of things to remind you about as well. For those for cases which are price sensitive, we do offer a price promise at AlphaBiolabs. If you are shopping around and get quotes from alternative providers, we just need to see a copy of those quotes, and we promise to beat those quotes by a further 10% off the whole quote, so not just the test fee, but the reporting fee and any collection fee as well. So that's our price promise to you. And also a charity initiative, just a quick mention to that, giving back. We run a draw every 2 months. Your name will be in that hat if you've instructed us at least once in the calendar year. And if you are the lucky winner, your name is drawn out. We ask you to nominate a charity of your choice, and we will make a £500 donation. It can be related to work, so children's services, child welfare, etc., or it could be something else that's personal to you or your family. As long as they're a registered charity in the UK, we will make that donation. So just bear that in mind as well. So finally, thank you very much for listening. Please do take a moment to complete the very short survey that you will see on the screen in a minute. You can request copies of the two guides that both myself and Ashley have mentioned this morning. We can send them to you electronically, or we can send you hard copies in the post as well, which can come to your office for you and your colleagues. So please do take advantage of that. There's really useful content in there, which I'm sure you'll find of value. So finally, thank you very much for your time this morning. We do appreciate it. And enjoy the rest of your day. And we look forward to seeing you again soon on the next round of AlphaBiolabs webinars. Thank you and goodbye.